Let's hear now from a clinician involved in the public health response to HIV. Dr. Adeiza Ben Adinoyi is the head of health and care unit for the Africa region of the Red Cross and Red Crescent Societies. Thanks so much for joining us here on the programme. Explain to us how much COVID-19 has disrupted your work, your response to HIV/AIDS in Kenya and the rest of Africa.
Thank you very much. As you know, in Africa, we have 25 million people who are living with HIV/AIDS. And 16 million of these people are on critical life-saving antiretroviral. So just as you've mentioned in the introduction, the supply chains that have been cut off with respect to these medical life-saving drugs has, in general, affected the availability of and the access of these people who should access this treatment. And we are seeing that on the general perspective, that there are reports of 85% of HIV programs being disrupted, either with respect to inability to conduct preventive services, inability to carry out life-saving consultations to deliver medicines. So we are seeing all these across different HIV programs, which of course is very, very concerning for every one of us who is engaged in the public health response against HIV.
And who is the worst affected, and in which countries, would you say?
Well, I would say, as you know, HIV affects, of course, the most vulnerable, poorest of our communities. And of course, we are seeing COVID pandemic also having its secondary impact with respect to this population group of people, cutting off their livelihoods, increasing food insecurity, lack of access to essential services. So those who, of course, are the poorest among the populations are suffering the most, and would say are the most affected by this kind of situation and disruption of services.
And Dr. Adeiza, the UN has said 500,000 more people may die of AIDS as the coronavirus pandemic disrupts the life-saving treatment that you've mentioned. And that number is more or less the number that have already died of COVID-19. So how do governments share the resources for both for HIV/AIDS and also COVID?
Yeah, so I think the target, the global target for 2020 was to have fewer than 500,000 AIDS-related deaths. And of course, it's unfortunate that this COVID pandemic is slowing the capacity to get to this target. So apparently, we need to make advocacy at all levels to ensure that the critical medical supplies that are needed, and of course the testing capacity that should continue and should not be disrupted, all these should be set on track, and appropriate investments are needed in this area. And of course, we will call on all the governments, all the key stakeholders to pay attention to this critical situation to avert imminent disaster.
Dr. Adeiza Ben Adinoyi, thank you so much for your time here on TRT World, and good luck with your work.